Thank you. I want to thank all of our witnesses for their testimony today. And I just want to note that I've worked with a number of my colleagues across the aisle to attempt to improve the Medicare Advantage program. So this is a bipartisan issue. In fact, I'm working with Mr. Arrington to ensure that MA plans promptly and fairly pay providers for services to ensure stability for our hospitals and less delays in care for patients. I've also worked with Ms. Van Dyne to ensure that patients entering post-acute care have access to the appropriate care setting, irrespective of whether they are on MA or fee-for-service Medicare. And I welcome those conversations. I think we need to have those conversations, and I think we need to have those thoughtful conversations. But we should have had them 2 months ago when we were marking up the one big ugly bill. A lot of Republican colleagues want to root out waste and fraud in the MA program, but let me be clear about what happened. 2 weeks ago, Republicans cut 17 million Americans' health care to root out waste and fraud. Republicans triggered $500 billion in cuts to Medicare to root out waste and fraud. And for what? Because Republicans blew up our deficit by $3.4 trillion. And that's according to the Nonpartisan Congressional Budget Office, their report that came out yesterday. So you're going to have to forgive me if I'm a little cynical and I don't believe in their commitment to the program integrity. President Trump also made a promise to the American people. He said he was going to lower healthcare costs. Well, let me ask you, Dr. Jane, you represent 12,600 constituents in my district and a total of about 300,000 covered people. I know you legally cannot discuss SCAN's Medicare Advantage bid information for 2026 until it gets approved by CMS, but according to this analysis, over 100 ACA marketplace insurers premiums are rising by a median of 15% in 2026. Do you agree with that analysis?
So SCAN does not operate in the exchanges, so we don't necessarily have a lot of visibility into that. What I will say is that there is the potential for there to be stress added to the system writ large because of changes in payments. Our providers may look elsewhere for revenue opportunities, and I think that might end up having an adverse impact on beneficiaries and other types of insurance plans. But I would say it's too early to say really what the actual impact is going to be across the delivery system and the plan environment.
Okay. Some insurers are reporting that President Trump's tariffs, possibly on drugs, medical equipment, and supplies, are driving a rate increase of about 3% on average. Do you think that the constant threat of tariffs might impact MA premium increases for next year?
We haven't yet seen any evidence of that, but it's certainly something that we're tracking in the marketplace right now.
Okay. And while SCAN doesn't participate in the ACA, in your professional opinion, do you believe that failing to renew the ACA enhanced premium tax credits will impact marketplace premiums?
Again, I think anytime that there's big shifts in coverage and in subsidies, there's potentially impacts on other lines of business. So that's something we haven't seen any evidence of yet, but it's obviously very early, and so it's something we're monitoring for going forward.
Great. Dr. Fiedler, I want to ask about value in Medicare Advantage. Right now, I think that one of the flaws in the system is quality measurement. In the quality bonus program, how are MA plans incentivized to provide high quality?
So in principle, we measure plans on a variety of, their performance on a variety of different measures in terms of getting patients appropriate care and other measures. I think my concern is based on the evidence we have that it's not particularly effective in encouraging plans to actually improve care as opposed to encouraging plans to invest a lot of administrative cost in optimizing their scores on these measures.
I think that one example of how we inaccurately measure plans' performance is the overturn rate for prior authorization denials. From 2019 through 2023, more than 80% of denied prior authorization requests that were appealed were overturned, and most seniors don't even appeal their authorization denials. They just kind of give up. Dr. Jane, would measuring plans' prior authorization overturn rate improve these procedures and potentially decrease delays in care for patients?
I think measuring that kind of rate and making it transparent to beneficiaries is one of, I think, the best ideas out there to actually create real transparency for folks about what they're actually buying. I think one of the biggest challenges with the Medicare Advantage industry right now is that many of the beneficiaries don't actually know what it is that they're buying because they may not have an active healthcare need. A few years later, they may develop a cancer and they would like to go to an out-of-network cancer center, and unfortunately it's not necessarily available to them, and they didn't know that that wouldn't be the case. And so again, I think that the idea that you propose, the idea of making transparent the overturn rate, is one of these kind of great ideas that could potentially make the program far more transparent to people and hopefully over time improve performance.
I appreciate your testimony, and I yield back.